Have you ever taken a gulp of water and wondered, what exactly is happening back there in your throat? How do you swallow, take a deep breath, or even let out a massive yawn without everything just going down the wrong pipe? Well, welcome to this explainer. Today, we're diving straight into the anatomy of the soft palate. We're going to decode exactly how your palatine muscles manage all of these totally vital everyday functions. If you want to really understand the intricate hidden machinery of the human body, you are definitely in the right place. So let's just jump right in.
It's a simple enough question, right? But the mechanics behind it are actually mind-blowing. To understand this, we've got to realize that the soft palate acts as this brilliant biological trapdoor. It's the physical barrier separating your oral cavity from your nasal cavity. Literally, without this trapdoor functioning perfectly, every single time you took a sip of coffee, it would shoot straight out your nose. Yikes!
Section 1. The soft palate trapdoor. So, think about the roof of your mouth. The hard, bony part is right up front. But if you go further back, you hit the soft palate. It's essentially this mobile, muscular continuation of the hard palate. And by sitting exactly where it does, it partially separates the nasopharynx above from the oropharynx below. This is your muscular palate. It's highly mobile, it's super elastic, and it is always ready for action. But, a trapdoor needs a solid frame. Before we meet the 5 distinct muscles that actually operate this whole system, we have to talk about the palatine aponeurosis. Think of this as the foundation of a house. It's a thin, really tough, fibrous connective tissue plate forming the base of the soft palate. It acts as the ultimate anchor for all the palatine muscles we're about to explore. And honestly, here's a wild fact. This super strong anchor plate is actually created by the tendon extensions of just one of those muscles, the tensor veli palatini. Pretty cool, right?
Section 2. Palatopharyngeus, the pharynx elevator. All right, let's meet our first muscle, the palatopharyngeus. Notice how this long, longitudinal muscle extends all the way through the soft palate. It originates right up at that aponeurosis we just talked about and then drops down laterally, right behind your palatine tonsil. As it travels down, it forms the palatopharyngeal arch, which, by the way, is a structure you can actually see if you open wide and look in the mirror, before it eventually anchors down at the thyroid cartilage of the larynx.
So what's the big takeaway here? Well, when you swallow, this muscle contracts. And as it shortens, it violently pulls the pharynx superiorly, anteriorly, and medially. Basically, it yanks your throat upwards and closes it inward, completely sealing off the nasal passage. Because of this powerful upward pull, your food is forced to go safely down the esophagus and absolutely not up into your nose.
Section 3. Palatoglossus, anchoring the tongue.
Moving slightly forward in the mouth, we hit our second muscle. Notice how the palatoglossus actually arches down from the aponeurosis to anchor straight into the lateral root of your tongue. Because it starts outside the tongue but inserts directly into it, it acts as an extrinsic tongue muscle as well as a palatin muscle. It's literally bridging the gap, running right in front of the tonsils to form the boundary separating your mouth from your throat. And this brilliantly illustrates how the body controls the flow of food. When the palatoglossus fires up, it lifts the back of the tongue and pulls the soft palate down. This action actually narrows the throat opening, the oropharyngeal isthmus, almost like a funnel. It effectively closes off the oral cavity from the throat behind it, which allows you to safely and forcefully push your food backwards. It's all about precise pressure control.
Section 4. The muscle of uvula.
Okay, this next one is super interesting. You know that little punching bag hanging down in the middle of your throat? Yes, it is actually a muscle. The muscle of the uvula originates from the hard palate and the aponeurosis, and it runs straight back, right above a muscular sling, to form the main bulk of the uvula itself, ending just under the mucosal lining. So what does this little guy do? Well, working with the other palatine muscles, it lifts and scrunches up. By elevating and getting shorter, it acts exactly like the final piece of weather stripping on a heavy door. It guarantees an absolutely airtight, watertight seal between your throat and your nasal cavity during a swallow.
Section 5. Lifting and tensing, veli palatini. Now we arrive at a pair of highly specialized muscles up near the base of the skull. Looking at these two side by side perfectly highlights their distinct spatial relationship. You've got the levator veli palatini lying medially, meaning closer to the center, and the tensor veli palatini positioned laterally to it, further out. They sit right next to each other, but their jobs are totally different, yet perfectly complementary.
As their names hint, the levator is the lifter. It draws the palate up and back during a swallow or yawn. But the tensor is the tensioner. It pulls the palate taut. But here is an incredibly practical, everyday fact. The tensor also attaches to the cartilage of the auditory tube. You might know it better as the eustachian tube. When the tensor contracts, it actually pulls that tube open to equalize air pressure in your middle ear. That is literally exactly why yawning or swallowing pops your ears on an airplane. Mind-blowing, right?
Here's where it gets really fascinating. Notice the mechanics of the tensor muscle. Its tendon drops down and literally wraps around a tiny bony hook called the pterygoid hamulus before turning a full 90 degrees horizontally. It creates a literal biological pulley system. Because of this sharp turn around the bone, the muscle can pull sideways to stretch the soft palate perfectly flat and super tight.
And here is a quick mini hook for you. This part is so often misunderstood by anatomy students, but it's a completely vital detail. While 4 of the 5 palatine muscles are controlled by the vagus nerve, cranial nerve 10, the tensor veli palatini is the solo rebel. It's uniquely innervated by the mandibular nerve, a branch of cranial nerve 5. It is the absolute only palate muscle with this separate, distinct wiring.
Section 6. Summary. The swallowing network.
Let's bring all of this together. From the palatoglossus narrowing the throat and anchoring your tongue, to the levator lifting the trapdoor, the palatopharyngeus elevating the throat, the uvula muscles sealing the gap, and the tensor popping your ears when you yawn, these 5 muscles work in absolute perfect synchrony. Every single time you swallow, this entire network springs into action in just a fraction of a second.
So think about that incredible biological pulley system and the sheer amazing complexity happening in the back of your throat the next time you swallow your coffee or pop your ears on a flight. Which of these palatine muscles surprised you the most? Let us know. Drop your thoughts below, and if you want to keep unraveling the incredible mechanics of the human body, be sure to subscribe for more simple, visual medical explanations. We'll see you in the next explainer.